So let's come to the second part. To start with, I'd like to talk about the uniform, the importance of uniform as a symbol of nonverbal communication. We know that in the lecture of verbal and nonverbal communication, how people dress also represents something in communication. Your uniform is a means of telling or informing other people of your professional identity without verbal communication. For example, if you dress in a nurse uniform, you are a nurse. If you dress in a police uniform, you are a police. But also, name badge is important. For someone who claims that he is a police but without showing the name badge, you would challenge that if he is a professional policeman. Common, right? And so, what is the positive aspect for a nurse? If you wear a uniform, what is your advantage? So firstly, the patient easily recognizes that this is a nurse, that you will receive treatment, that he or she will receive treatment from you. And secondly, your uniform should be tidy and clean and without germs. And thirdly, if you go outside, for example, a community nurse, does a community nurse require to wear uniform? Of course. And when they wear uniform, the people will know that he or she is a professional, and even though he is not working in the clinical settings, he is working in the community settings, he is still a professional nurse. So the uniform can help you to establish a non-verbal communication that you are a professional. So let's talk about another topic. No, not only in local Hong Kong, all over the world there are health workers, of course, and in some developing countries, the importance of community health workers cannot be neglected, because in the developing country, the medical access may be very limited, and the importance of community workers is there, that they can spread to a small village or rural areas and deliver the health message and deliver the healthcare service. You may go to the YouTube channel I show below. It may not be available in your lecture notes, but I will show it separately in another content that you can click into, and then please spend some time to watch that film about how the BBC Media Action, they train the community health workers on communication skills. Then you can see what kind of techniques that the healthcare workers applied, and there will be multiple choice question in the end of this lecture. Then you need to read this clip to know the answer. Okay, then in the final part of this lecture, I'd like to share two theory or two models about the how to deliver the health program, or how to deliver some health message or health policy. First one is the diffusion of innovation. It is originally developed for marketing use. It tried to explain or predict the acceptance and rate new ideas or technology in the population by different adopters. For example, something new happened. It can be a technology, for example, a new iPhone, some behavior, for example, a new transportation is used, or some communication channels are developed, if the people is willing to use it, or some new service that I will use as an example. For example, the telephone appointment system I mentioned in the GOPC service. The telephone appointment system was available, say, a few years ago, and how the people accept this kind of service. This is something new happen, innovation happened. So through different communication channels, the service is promoted to the public. For example, the in the newspaper, in TV, or in the poster available in the GOPC clinic, different kind of communication channels are used to deliver and telling people that, oh, something new happened, please try me. And then, what is the time involved? How long time does the people use it to accept or use the innovation by different groups, of course? Maybe some young adults, the housewives, the elderlies, or some people with disability or with hearing problems. They will have behave differently on how they react on the new innovation. And finally, the social system in which the innovation is proposed. For example, as I said, maybe the general public, or maybe the young adults, or maybe the elderly. I'm sorry that the font is a little bit affected in this version of PowerPoint, but it should look normal in your PowerPoint slide. There are 5 factors influencing the adoption. First one is the relative advantage. Is this innovation good to me, or does it carry any benefits to me? Second one, compatibility. Am I able to use this? Do I have a telephone at home so that I can use the telephone appointment system, or do I have a mobile phone so that I can call to the telephone appointment system? If you have a telephone or if you have a mobile phone, then the telephone appointment system is compatible to you. And the complexity. Is the telephone appointment system difficult to use? Well, as I used before, my experience is for young adults, for students, or for normal adults, it is user-friendly. But if it is for the elderly or new user to never use the telephone appointment system, then it is a little bit complex. Tritability. Before this innovation officially launch, does it provide a period of trial time for the public to try to use, which is a few years ago, that the patients can call the telephone system, or they can still use the walk-in appointment. That two systems are running in the same time, so that the people can have time to trial to see if they can accept this innovation, the telephone appointment system. The last one is the observability, and how is there anyone teach them how to use it, and how can they observe if this adoption is useful for them or beneficial to them. Okay, so we will find a bell-shaped curve again when we collect all the data together. It applies on almost every innovations. I will take the telephone appointment system as an example again. Firstly, there are some innovators. They want to be the first to try everything. A small part of people, they are the innovators. They want to try everything first, no matter what is launched new. They want to be the first to queue up. Just as the iPhone or the iPad launch, there is always some people sitting in front of the computers and ask for the first batch of delivery. Okay, then is the early adopters. Here you will find the characteristics of this kind of people. They want the information and education. They are the show me type of people. When we have the first batch of promotion or the first batch of communication channels launched, for example, the poster is posted for a week, and then people know that, oh, there is some new service, the telephone appointment system is now available, try. Then the early adopters, for example, they are the opinion leaders, or we call the KOL, the key opinion leaders. Now, they will always be the very early ones to try new things. And then for people, they need this kind of people together with the early majority. Early majority are not the leaders, but this kind of people, maybe they need this kind of service. But for example, the working people, they have no time to queue for the GOPC. After they know that there is a telephone appointment system, they will be the early majority to use this service. They will say, yes, oh, that's good. I don't need to wake up early and then queue up in the GOPC for an appointment time. I can use the telephone now, so it is convenient to me. They will be the early majority. So, after this period, there may be social marketing approaches. After the communication channels host for weeks, there may be second batch of communication channels. For example, there may be a TV show teaching people how to use the telephone appointment system, or it will be mentioned in some health seminars that do you know how to use the telephone system? For example, a nurse will go to the community center and help the elderly and demonstrate them how to use the telephone appointment system. So the nurse helped the elderly to understand the telephone appointment system. Then there is the late majority. They will appear and try to use the new innovations. And finally, there are some lectures. Unfortunately, some people do not want to try new things. There are always some people like that. They will not try new things until there is regulation or legal intervention. For example, nowadays, can you queue up in the GOPC and then ask for an appointment time? No more, because the regulation now require you to use the telephone appointment system. And then this type of people, they have no choice but to try to use the telephone appointment system. That is called Make Me. Okay, another model can show you about the community health useful in the health community settings is the community readiness model. It is used for formative research tools, or it is a guide for prevention efforts. For example, you have a vaccination program to execute and to promote in the community. Then there are 6 dimensions you can assess and see if the community is ready for that program or vaccination campaign. I use this example. The first one is past efforts. Is that community actively involved in the vaccination program, in other vaccination program? Secondly, is the community have enough knowledge of the efforts? That is, do they know that the importance of vaccination? Do they have this kind of health literacy? Thirdly, the leadership. The leader of that community, for example, the chairman of the residential area or the district councillor, are they support to this campaign? 4, is the community climate. Is the people like to be actively involved in government campaigns, or do they all the people are actually they spend little time in the community, or they always work outside and spend little time in the community? 5 is the community knowledge of the issue. Do they know about that influenza can be prevented by vaccination? 6, resources. For example, is there enough space to carry out or execute the vaccination program? Is the health center convenient to that community, etc.? For each dimension, you can measure the readiness from a score of 1 to 9. This is the score you can use as a guideline. For example, if I say about the leadership, is the district council member in that community aware of the vaccination program, if the district councillor is a rubbish and do nothing, they are not aware about the health program launched by the government, then the readiness is one. But or if they have very high level of community ownership, the district councillor do everything actively to the residents, then they will actively promote the vaccination program with the community nurse or with the local health centers. So this, the above are the two models that I would like to introduce to you. And then I will talk about the community health call center. It may not be available in every cluster or institution in Hong Kong, but it is a service available quite long time before the internet is common or in Hong Kong. Of course, in our student age, all of you here, internet is the most inconvenient communication channel to you. But for some chronic patients, for the elderly, internet is not that familiar with them. They are highly rely on the telephone. So if they cannot or not able or not necessarily need to go back to the clinic or hospital, telephone is a useful tool for them to have consultation with nurse. It is a successful and promising model to improve the community health and reduce unnecessary acute hospital admission. As you know that the acute hospital nowadays in Hong Kong are all tight, and the use rate is too high, over 100%. So you want to reduce the unnecessary admission. So there is a one-stop service. As you can see, just like a call center, the nurse can provide follow-up calls and receive call when the elderly or the clients had certain inquiry, and do a simple triage and tell them if they need to come back for follow-up consultation or they need acute immediate admission to the hospital. So finally, let's give a brief revision or some summary on the role of communication in the health programs. And nowadays it is competitive and globalized business era. So communication is the major tools that we can play comprehensive and innovative roles in the overall success of community and public health program. How? Exchanging information in an effective and proper manner. Okay, information we always have, no matter how long time before. In 50 years ago, maybe newspaper is the most effective and proper manner to exchange information. 30 years ago, it may be TV. 10 years ago, it may be some web page. But nowadays, do you still look at web page regularly? No, we are using a very online and interactive mode of communication. We use social media. So nowadays, it becomes the social media to exchange information in an effective and proper manner. For example, if I want to deliver a health message to young people, safe sex, please use condom. Do I still need to make a comprehensive website saying that the consequence of sexual disease and the importance of use of condoms? No, if I use some social media, for example, Facebook, I make some comics, I draw a few pictures and use some simple slogan or short passage of information, it may be more useful for young people to know that the importance of use of condoms, rather than giving a large pieces of article in newspaper, doing any TV show, or make a very comprehensive web page. They may not be as useful as some social media. So the health organization and health department can communicate information about the health program in an ethical and systematic manner. For example, I use the use of condom again. It needs to be promoted in an ethical way. Of course, I can't have any discrimination on people who are not willing to use condom or they do not know how to use condom. I need to be ethical to teach everyone to how to use. And the communication, it helps building and create strong relationship with the media, that the information towards public health program can be communicated properly and ethically. So if it is running successfully, an effective communication can provide tips for the policymakers. For example, if I launch the use of condoms in the social media and it is a successful one, then the policymaker will know that, oh, the young people nowadays, they know how to use condom, and then we have the second approach of the how to deal with the sexual transmitted disease if there is still cases of sexual transmitted disease in young people. Then they will know that, oh, next time I can use the social media again. And the society and community can be motivated and encouraged about the healthcare issue. And of course, if you launch a public health program effectively, it is good for everyone's health as a consequence. So finally, another message to give for your information. This one is a very old and traditional one. It is not in any social media, but it can be used as a material for the people to deliver message. For example, even for the social media in the Facebook, the administrator who hold the Facebook account of Department of Health, does this necessarily to be a health professional? Not really. It may be IT person or just an officer, admin officer of the office. Without certain health education knowledge, how can that people deliver health message? So this is the community health partnership communication works. Regularly, the Department of Health will deliver message of that period of time. So you can see that in each season, September to December of a year, there is the different issue. And in that period of time, this kind of disease is new or common or need to be alerted by the general public. Then the Department of Health will deliver a page of materials and deliver and send to the local policymaker or the partnership, local partnership, for example, the district councillor. So you will see in your residential area, the district councillor suddenly posts up a please beware of certain disease poster look like that. How can the district councillor, who is originally an accountant, know that there is a kind of disease coming in Hong Kong by the Community Health Partnership Communication? It is provided by the Department of Health. So that is to engage the residents in promoting their own health. That's all of today's lectures, and you can find some information in this reference. I will also show you the link of the video that you need to watch and then answer the question. There will be 3 multiple choice questions about this lecture today, and you need to submit it to the in the assignment of Blackboard, and then do the submission to show that you have attended today's lecture. Okay, thank you very much.